Hello, everyone. This is Dr. Belinda Wilkerson my mouth is not working already. Welcoming you to another episode of College and Career Conversations with Dr. B. This evening's segment is part of our Representation Matters series, and I am thrilled to bring you a guest that you are going to learn so much from. So make sure you run off and get your cup of coffee, your tea, your water, whatever it is, whatever beverage you're going to be using or drinking at this moment, and come back to us. So I am the owner and founder of Steps to the Future, which is a college and career counseling service. The goal at Steps to the Future is to help families eliminate random acts of college planning. If you're watching this on Facebook, please make sure you follow my page so you get all the updates that I give out there on college and career information, which I do daily. If you're watching this on YouTube, please subscribe to the channel. I am trying to increase my numbers of subscribers on the channel. Also, for those of you that are new here, please make sure to join the conversation, and you do that by just making a comment or ask a question, and we will make sure that we address that during the broadcast. So let me introduce our guest to you this evening. Dr. Mica Mitchell is a pediatric physical therapist and a professor of physical therapy at Methodist University. She has experience as a pediatric physical therapist in a variety of settings in North Carolina since 2003. She has received her Doctor of Physical Therapy degree with a specialization in pediatric science from Rocky Mountain University of Health Professions, a Master of Physical Therapy degree obtained from East Carolina University, a Bachelor of Science from Methodist University right here in Fayetteville, North Carolina. She is an American Board of Physical Therapy Specialist, board certified clinical specialist in pediatric physical therapy. Wow, that's a mouthful. And when Dr. Mitchell comes on, she's going to tell us what all of that means. Dr. Mitchell has a passion for research and identifying and reducing disparities, advocating for the profession of physical therapy, and teaching future physical therapists and physical therapist assistants. So folks, please make sure you stay with us, come back, and we'll be with you in a few seconds. And welcome back. And I am going to bring Dr. Mitchell on the screen now. So everyone, this is Dr. Mica Mitchell, and I am so thrilled to have her with us this evening. Welcome, Dr. Mitchell.
Thank you. I'm excited to be here. I appreciate this opportunity. So thank you.
You're welcome. You're welcome. And again, folks, I had the pleasure of getting the opportunity to meet Dr. Mitchell because of a past guest we had on, Tracy Sherrod, who is the director of library services at Methodist University. So they work together.
Yes.
So, you know, these few degrees of separation are fantastic because it gives you the opportunity to learn about folks and find out what's right in your own community that you didn't know about. So Dr. Mitchell, tell us a little bit about how did you find your way to Methodist University for your first degree?
Okay. I am originally from New York, and I was looking at college opportunities, looking at schools locally in the New York State area, in the New York City area, and also considering maybe I'll leave New York and find somewhere else to live and to go to school. And through happenstance, lots of communications through different universities and colleges, I found Methodist University. At the time, it was Methodist College. I came to visit campus. I wasn't convinced that that was where I was going to end up, but as soon as I came to campus, met the people, it was a done deal.
Okay, so what was it about Methodist that attracted you?
I think it was the campus. It's beautiful. It was the people. I had opportunity to play basketball. I thought I was going to be an athletic trainer, so I had the opportunity to explore that. And it just something about it, and I have no regrets because I'm here as a faculty member now. So
that's fantastic.
It was a great decision.
That's a wonderful testimony to how to choose a college. A lot of times students are afraid to move out of their geographical area and want to stay close to home. So the fact that you said, "Hey, this is something that's going to work for me. Let me see what happens." So then after you finished at Methodist, you went on to East Carolina. So tell us about the physical therapy program there. So what made you decide to become a physical therapist? Because you did say earlier that you wanted to be an athletic trainer. What happened that made you change your mind?
And so athletic training is a great field. I just realized that long term, that once I got into it and I worked with some teams, it was still an interest of mine, but the passion, like the strong desire to do it wasn't there. And so then once again, let's consider some other options. And once I looked into physical therapy, I had previous shoulder injury. This is a story of how a lot of people get into physical therapy, or just the understanding of what this profession is. And at that time, my physical therapist mentioned the career, and it was just in passing, like, okay, I was like high school athlete, like, okay, yeah, sure, maybe. And so then it came back around of, what am I going to do with my life? And I really did some research into what I needed to do to go from, with my bachelor's degree when I graduated, and then what do I need to do to be able to apply. At the time, it was a master's program.
Okay. So tell us a little bit about your master's program at East Carolina. What are some of the expectations that students can have going into a physical therapy program?
And so it was probably a little bit different then. So kind of fast forward to what you should expect for now and consider now. As if you're entering high school, if you're entering college, it's never too soon to consider physical therapy. You want to know that this is what you want to do. So that means look at some volunteer opportunities to observe. And the more settings that you can observe in, then you really can solidify your desire to go into this field. There's so many specialty areas that you could end up practicing in. And so one, knowing what physical therapy is, it's helping people move in a variety of settings, variety of ages, in different settings where people live, where they play. And just knowing, what are your strengths as a student? What classes do you need extra support in? And knowing what classes are required for you to apply to PT school. There are some classes, some prerequisites. So in addition to the degree and the classes you have to take to graduate with your bachelor's, there are other classes that if it wasn't included in your degree, you also need to take, and having those prerequisites done. And so just knowing that, having that awareness, that helps you plan out your undergraduate career. So maybe you don't have to wait a year or two after you graduate with your bachelor's to then be able to apply to PT school.
Okay. So for folks that are just joining in, we're with Dr. Mica Mitchell, who is an assistant professor at Methodist University, and she's sharing with us her story of her educational and career journey to the field of physical therapy. So one of the things you said, when you went to school to become a physical therapist, it was a master's program. So how is it different today?
Yes, I went for 2 years and got my master's after my bachelor's degree, but now the degree is a doctor of physical therapy. That is an entry-level physical therapy degree. And that is what any student applying to PT school right now, they would be getting their doctorate of physical therapy once they graduate from PT school.
Okay. How competitive is it to get into a PT school, a PT program?
It's competitive. It is very competitive. And I think, I don't know if I mentioned this, but it is a 3-year degree. So after your bachelor's, there's 3 more years to get your doctorate of physical therapy. And it's competitive because there are only so many seats that are available for incoming PT students. So at Methodist University, we have 40 students that we will bring in for each cohort. So that's 40 seats, and we may get 200 applicants, or, in a cycle, we may get more. There are some schools that get thousands of applications per cycle of admissions, and there are only, so many seats to fill. You can't go beyond that number that your school is allowed.
That's so important because I think sometimes students feel that the seats are endless, that there isn't a cap on it. So it's really important to understand that there is a cap on the number of seats because you need to have the right clinicals available to students. You need to have enough faculty members in order to teach the classes that students need. So there's a lot that goes into those decisions on who those 40 students are going to be at Methodist, and then at other schools where they may have larger numbers. But again, that's one of those important things that I think students need to take some time and do some research on it. So tell me a little bit about the physical therapy program at Methodist. What would students expect?
So at Methodist University, we have a beautiful campus, a beautiful building, and we pride ourselves on our commitment to our education and to ourselves as faculty members. We are lifelong learners. We push our students to excel in the classroom as well as after when they are clinicians. We just bring forth the most current evidence and the most appropriate information that our students need to know, because at the end of PT school, you do have to pass and take a national exam. So that's always something that we're considering, the information that we're giving our students, the knowledge that they're gaining, the critical thinking skills that they're learning how to think like a physical therapist. All of those things are going to allow them to be successful when they graduate, when they take their boards, when they practice. So it's not just about we're here for the students right now, we're here for them right now, in addition to in the future and the therapists that they will become. And always just we push ourselves for excellence and pushing them for excellence as well.
Okay. So say a student is now in the PT program, they've come in, with flying colors, or they were fortunate enough to get one of those 40 seats. Because one of the things our students always ask us about the possibilities of internships. So what types of internships might be available to students that are attending a PT program at Methodist?
That's a great question. A lot of our curriculum, especially toward the third year, is clinical experiences. And so we layer that into the curriculum and into the program. So after their first year into their second year, they're able to get a little bit in the clinic and be rejuvenated as to the reason why they wanted to be PTs. They're seeing like, oh yes, this is why I wanted to be here. Yes, I'm learning and I'm in class, and sometimes it's a lot. It's an intense program. You're taking lots of classes where the demand for that knowledge is going to be consistent. But there are opportunities locally within a 2-hour radius for clinical experiences in a variety of PT settings. There are opportunities. We have partnerships and agreements with physical therapy clinics outside of this regional area in different states. So the possibilities are available for, there are lots of different specialties of physical therapy. So there's pediatrics, there's geriatrics, there's oncology, there's, you can see somebody in the hospital, you can see somebody in a clinic, you can see someone in their home. So there's lots of settings and then lots of specialties. And we try to have options for our students to choose from. And then sometimes if there's not an existing option, we have an amazing team that help our students to find something else maybe that they're dreaming big about.
Okay. So how soon within the program would a student have to determine if they wanted a specialty?
You don't have to determine that. When you graduate from Methodist, everybody, with all the classes that we teach and the knowledge that they're required to know, you will graduate as a generalist physical therapist. So you will have the information you need to be able to pass your boards, to be able to work in a variety of settings. You can decide, maybe within your third year, those last couple of clinical rotations that you choose, if you have an idea, and it's good to have an idea, but not to be too rigid about it, because maybe you get into that practice setting and you realize, maybe this wasn't what I thought it was going to be. And that's okay. Like, this is the opportunity, the time for learning and exploring, where you can, but you're going to learn something from every opportunity that you have.
Okay. So we have a question here from one of our regular viewers. Thank you so much. Um, so she wanted to know why you chose to teach instead of being a physical therapist, but don't you do both?
I do both. But
Yes.
thank you for that question. This is part of why I was able to come into academia without too much hesitation, because part of being a physical therapist educator, I still am required to maintain clinical hours, and see patients as well, because we want to be relevant and clinically relevant with the content that we're sharing to our students. And so I still get to practice. I still have an opportunity to work with patients, and it's the best of both worlds. And the reason why I chose to go into teaching is because I've had students come into the clinics that I've worked at in the past, and it was a great opportunity to share the things that I've learned, and sharing the things that I've learned with the expectation of, you know what, maybe you don't have to make this mistake. Maybe you don't have to go down this path. I can kind of give you a heads up and just kind of share what I have been able to learn. But then it was only just me. It was one of me and the one opportunity to have one student at a time. And it's like, well, if I could be in front of more students and I can share this passion, because I am team physical, like hashtag choose PT, and then even beyond that, it's go peds. So all of this excitement and passion and knowledge that I can share with this next generation, I feel like that's a win-win.
That's fantastic. I love your enthusiasm. It just, your passion for what you do just exudes through the screen. So that's fantastic. I love that. So I know you chose, and we said it in your bio, but you chose to go into pediatric physical therapy. Why pediatric and not one of the other areas?
Yeah, as a student, it was all these opportunities. Every new class, I was like, yes, that's it. I'm going to do that. Then the next class, oh, wait, that's awesome too. I'm going to do that. And the cool thing about physical therapy is you really can go into, there's so many options, and you really can specialize and be so unique that you are, sought after for your skill set in treating different types of patients. And why pediatrics? I get to play with kids and babies and toys, but most of all, I get to help a child move. And most of the children that I treat, they have an issue moving in one way or another. And I have an ability to see what the problem is, and I can come in and make it fun. And sometimes I can distract them and they don't realize how hard they're working. Sometimes they're already onto my game and they're like, I'm not falling for it. And then we still have to work anyway. And so it's just never the same day. It's lots of fun. Sometimes I'm exhausted at the end of the day having to come with all this energy, but it's worth it when you see the progress in these little ones that have, you know, had their limitations in the past, and I can come in and say, you know what, this is what support you need, or maybe we can do these things, and encouraging the families and the child to keep trying and being able to move better.
Oh, that's fantastic. It sounds so rewarding, and working with young folks of all ages is always a pleasure. Anyway, I'm biased about young people. I love young people, love working with young people. So I get thrilled when I see someone else that feels the same way I do about the work that they do. So tell us a little bit. So what type of research would a student have an opportunity to do if they were pursuing a degree at Methodist?
Yes, our faculty members have research that they work on annually. And so students have an opportunity to partner with the faculty members on research. There is also an opportunity if a student has a really good idea and they want to see it through from start to finish, they have an option to do that as well. We have a human performance lab. We have a motion capture lab. So if you've ever seen those video game um, videos of people creating video games where they have like those little magnetic markers on them. We have a facility that can do that. And so the possibilities are kind of endless onto what it is that we can work on. I think when it comes to research, looking at what's missing is a great first start to say, what is it that's not in the the literature? What can I find? Is there a way that on a small scale, and
Right.
eventually maybe a larger scale, look at what differences we can make and adding to that body of literature that's out there for research for physical therapy?
Okay. So I know in one of our earlier conversations, we talked about the disparities in healthcare. And we know with everything that's going on right now and in our society that we're seeing more and more information come out about the disparities in healthcare. I always share my story with people that I knew that I wanted to become a teacher, but I didn't have my first Black teacher until I was in seventh grade. And that just validated for me that, oh, I can be a teacher. That's why I like this series of Representation Matters, because I truly believe for some students you can't be what you don't see. So I am I think, as I think about them, I'm thinking that you're probably the first Black physical therapist that I know. I've never had to go to one, but I'm just thinking, do I know anybody else, or have I seen anyone else in that field? And, in the work that I do, or just being out and about and networking and stuff. And I don't think I have. So tell us about the work that you're doing in order to decrease those disparities, or to expose them, or to make it better.
Yes, I address, and through research and just through my volunteer work, disparities within patient populations, but then disparities within our these differences of representation. And so, to your point, I have not had a Black physical therapy educator, and it was probably about 3 years ago that the first time I saw a Black physical therapist in a educational setting. I've done lots of continuing education courses, and it was one of those things, like, I didn't realize the impact that it would have when I actually was able to learn from and see that in front of me. I've always been able to look at, educators, and pull from them the strengths and the things that I appreciated about what it is that they offered, their style, the information that they're giving, the knowledge that they have, but never having seen that in front of me. And so I work with a organization. I volunteer with Ujima Institute, and it's just really, we have this opportunity to use our representation to support the next generation, and letting students know that you may be in a PT program that there's nobody that looks like you, or maybe not a lot of people that look like you, and beyond looking like you, maybe it's somebody that doesn't even have your same lived experience, because we can look like each other but still have different lived experiences.
Right.
And I think that's the biggest thing now. It's really addressing these disparities of, we have to support the people that are around us. And so there's a big push in our profession, and everywhere you look, there's a conversation about diversity, equity, and inclusion, but then we have to take it beyond that. And how are we supporting the students, the faculty, the members of society that are different, and that maybe need something different than what you're accustomed to providing, or have an awareness of what their needs are. And so that's some of the things that drive me, and meeting students that
Mhm.
aren't getting, just need to talk to somebody that looks like them,
Right.
and be encouraged in where they are, and what they're doing.
Okay. So could you tell us a little bit about the Ujima Institute and some of the advocacy work that they are doing and other work?
Yes. And so we have Mindful Mondays. So on Mondays, we have Mindful Mondays and Mindful Mentoring, where it started out offering this to students as a resource last summer, after the pandemic shut everything down, and then George Floyd's murder, and the social unrest, and just lots of unknowns that were going on, and lots of unsettled spirits, and beings. And so we offered Mindful Mondays as a resource to PT students. And this was national because this is a virtual platform, through Zoom. And then we've gone on to offer it for clinicians as mindful mentoring, because we realized the community that it offered and that it brings, and that was needed, and we get that feedback that it's needed, and it's a place to learn, to grow, to be supported, and the information, it just helps you to become, the best person that you are, that you choose to be. What is it that we want to accomplish? We look at goals and things. And then also with the Ujima Institute, we worked on, and it was a collective of Black physical therapists, occupational therapists, and speech language pathologists that came and wrote a document called the Black Rehabilitation Manifesto. And this document really spoke to the needs of Black rehab providers for patients, and what we see as the problem. And, we as in a collective of about 100 people, but not so much what is the problems that we see, but here are some potential solutions. And just really, because there was so much at that time, last July and through, beyond, there was lots of questions on what can we do for allies, and people that wanted to support. And there was really no one source or place to go. And it was, let's come together and say, what are the problems as we see them? And then what are some solutions? And we can partner together, because a lot of times if your spaces are not diverse and you're not hearing voices of other types of people based on their lived experience, based on socioeconomic, based on religious differences, like so many things that include diversity, you don't have the consideration of other people when you're making your decisions. And so just knowing that when we're coming in, diversity, equity, and inclusion, we have to consider justice and representation, and knowing that the decisions that we make in any space, they support maybe the people that are not there yet,
Right.
because there's goodness to come from increasing diversity and differences.
Yes. Oh, you're speaking to my soul, Dr. Mitchell. I love what they're doing. I was on the website earlier this week. Well, this is Monday. Over the weekend, I was on the website and just was fascinated with the information and with that manifesto. And I'm like, okay, any of my students that are going to any of those fields or even talking about those fields, whether they're Black, brown, white, or otherwise, because this is the kind of information that we all need. This isn't just geared toward a particular population. And I think having the opportunity to have that type of information so that you can have a courageous conversation around some of the issues that we're facing. I love that you framed it as not just saying, here's a problem, but here's the solution. Here's what might help. So let's try this. So folks that are listening, please make sure if you have any comments or questions that you put them in. Make sure you're sharing this out with people, and make sure you're going to the website. So the Black Rehabilitation Manifesto, you will find that on the Ujima Institute website. You'll see it right there. It's beautifully laid out and everything. So take some notes. Those of you that work with young people who are thinking about going into healthcare, particularly one of the fields that Dr. Mitchell mentioned, have them have the opportunity to look at that. It's great for students to have information beforehand so they know what kind of supports are out there for them. So many times, too many Black and brown students may be a minority of one in a particular situation. This is already giving them a place where they can get that support, where they can get that nurturing, because as Dr. Mitchell said, PT school is no joke.
Yeah.
No joke.
It doesn't have to be unbearable. And it's not to say that you go somewhere and you go where you fit, because it's a two-way conversation. It's a two-way decision. You're applying to a PT school because of certain reasons, and those are reasons that you need to be aware of. Is it just because you are applying and you want to get into any school? But maybe, and I would like to challenge that to say, look a little bit closer at the programs that you're applying to, because yes, you want that acceptance, but you also want to know that you're making the best decision for yourself, that you will be somewhere where you're supported, because you could be an N of one, but have the most supportive environment and you can thrive. And so knowing that it's okay to have this conversation. You can ask about their diversity initiatives. You can ask about how they support students that are different. You can ask about, where are some ways where they're growing, because we're all growing, right? We all have our strengths and our limitations, but are we aware of those things and knowing that we have this choice. And I think also when you're looking at physical therapy schools, if this is something that you want, you need to look at the duration. There are now some schools that are offering a 2-year doctorate of physical therapy, but those are even more intense because they're designed to help people. There is more of a hybrid program. So a lot of it, what you're doing is online learning. You're doing your modules ahead of time, and then you're going to campuses for the intense lab periods of time. And so really sitting and getting to know yourself as an individual, as a learner, as a student. How do I learn best? Like, do I need to be in class in front of my professor? Or maybe what COVID has showed you is that maybe you can learn okay virtually in a asynchronous way, but there still is going to be that period of in-person time. And so really looking at at a PT program and making sure that yes, they're saying yes to me, but I'm also saying yes to them because I like what I hear and what I see.
That is so important. I know one of the conversations we have with students when they're looking into their undergraduate programs is thinking about an academic fit, a social fit. Do you see yourself on that campus? Do you see yourself as part of that program? It goes beyond the looks of the campus. I know a lot of times, well, pre-COVID, when students could actually visit campuses, I would ask my students, I said, so what did you think of that campus? Oh, it's beautiful. I said, okay. So tell me what else you noticed about that campus. What else do you know about it? And one of the things I like them to do, and I'm sure they can do this too with the physical therapy programs, is to pull up the curriculum. What is the classes like? What is it? What are your 2 years or 3 years going to look like in that particular program?
Yes.
Is it the same in this school as in another school? I also strongly encourage students to look at the bios of the faculty. What kind of research are they doing? Is that someone that you might hopefully get an opportunity to do some research with? How do you reach out to that person to let them know that you're interested in not only attending that program, being a part of that program, but perhaps doing some research for them? So again, it is digging a little bit deeper.
Yeah, and I think once you do that, then you have a confidence and you have an ability to understand and have a conversation with the potential faculty and students where you're going. There's a period of interviews. A lot of schools have interviews, and what that looks like is, it's not just please don't pull the list of interview questions for PT school, because maybe you might get answered some of those questions, but it really is an opportunity for you to ask questions as well. It's not just, we want to get to know you and make sure you're a good fit and that this place is where you can thrive. But I want students to ask me a question, and I've had some good ones. They're like, why Methodist? And I'm like, why not? It's a great place to learn. And we have, a beautiful environment, and not just the building, but just what we try to foster and the community that we try to encourage our students. And just knowing that everything before coming into PT school is competitive, right? So you're working on your GPA in undergrad, and you're trying to get the best GPA and trying to get the best, standardized test scores. You're trying to, just compete to be able to get an interview. But then once you get to PT school, everybody that graduates is going to be a PT. And it's like, you know what, this is the time now to work together, because working together in groups and group studying is what's going to be helpful, because lots of practice needs to happen, because our skill is in our hands a lot of the time. So we have to practice either the touching or the, the positions or the moving. And I try not to talk with my hands, but my hands are, a lot of what I
Right.
do. But that's, another point of consideration.
Yeah, that's so important. Thank you, Michelle Burton, for joining. Michelle is one of my consistent, loyal viewers. So I'm so thrilled that she was able to join in. Michelle has a daughter that is at Fayetteville State right now, and she has another daughter that has her own business. She's a graduate of FSU and has her own business, and Michelle has her own business. So I thank you so much, Michelle, for being here. And for people that are just joining in, please make sure that you are sharing this out with people. If you're watching this on Facebook, please make sure you follow my Facebook page so that you get notifications about any new videos that go up. And if you're watching this on YouTube, subscribe to the YouTube channel. So again, please, folks, let's get this word out, because we need our young folks to have the information that they need so they can make informed decisions. There's so much. When I think about when I was getting ready to go to college, and I was a first generation college student, so there wasn't anyone to help me with that conversation. I was fortunate in that my junior and senior year, my two school counselors were fantastic. Mr. Hamlin and Mrs. McDonald, I have to shout them out, because if it wasn't for them, I think I would have gotten to college, but they just made sure that I got there the right way. So again, having this information ahead of time, and knowing that this is what PT is, this is what it involves, because sometimes I think we get these ideas in our heads about a particular occupation without fully understanding all it entails.
Yes.
Would you recommend that students, if they have an opportunity, if they're thinking about physical therapy, if they have an opportunity to do maybe an informational interview or possibly shadow someone once COVID lessens its grip on us?
Absolutely. As with all of this, you need to know what you're getting into, right? So any opportunity to observe, there are lots of clinics in, different areas, and hopefully there's a clinic near where a student is interested in observing. And so, the post-COVID era where there
Mhm.
is possibly more availability to do that, that is a great idea. And if right now it's just a matter of reaching out and talking to a physical therapist, because there are so many physical therapists that specialize in different areas. Like I've said before, there's physical therapists that specialize in pediatrics, but they specialize in oncology, which is patients that have cancer. There are physical therapists that specialize in pelvic health, and so dealing with men or women that have pelvic health concerns. And so there's so much more than you can imagine. So if you think physical therapy is one thing, it's not. It's beyond that, and even the more. I think we as individuals can really make our mark, and that's kind of how I'm here.
Okay. And folks, if you want to follow Dr. Mitchell, you can follow her on Twitter, and her Twitter handle is on the screen. So please make sure you write that down. And it'll also be in the show notes, so that if you need to go back and watch it on a replay, that information will be there. It will live there for you. So Dr. Mitchell, what did you see as your biggest challenge as a physical therapist?
My biggest challenge is probably my desire to keep pushing forward. And so being a physical therapist, where I worked within a hospital system, and a lot of places do this, you have annual goals, and what is it that you want to work toward? Where is it that you're going? Because, if your intention is to be stagnant, that's probably not going to be in your best interest. And so the biggest challenge is always trying to make sure what I'm doing is that I'm walking into my purpose, that I'm doing what I was best at, but then always challenging myself. And so I do have a doctorate of physical therapy, but it's like, is there an opportunity for another degree, a PhD or a EDD or a DSC, a Doctor of Science? And so I think just always I'm always challenging myself. I have different certifications because I want to be able to bring forth the best options for my patients and not be limited to what I can offer them based on my own skill set. Because I've been fully supported in my career, in my profession. With the patients that I've treated, I have patients that periodically will check in even after they've done with PT. So when it comes to, barriers in that sense, I've been really supported. As a physical therapist, it's just trying to keep up pace with myself sometimes and having to understand that no is a complete sentence and it's okay to say no. Sometimes I want to follow it, but not right now, but being able to say no and being okay with that. But just knowing that I have lots of goals that I have for myself.
Okay. So one of the things I talk to students about is to consider the professional associations for a possible career, because I think professional associations can give them so much information and offer different types of opportunities. So could you tell us a little bit about professional associations for physical therapists?
Yes. So our biggest national organization is the APTA, which is the American Physical Therapy Association. And that is where you can find lots of information and resources about our profession, about career options, about schools. You can go there and look at what accredited physical therapy schools are out there and in your areas. And you can find resources as a consumer. So if you're like, I'm not going to PT school, but I think maybe I need physical therapy, there are resources there for you to find a physical therapist. So it has dual purposes. And it's as a profession, it's where we as PTs get our mission and our vision. Like, what are we? What are we doing? Why are we here? We want to transform society. We want to transform society by optimizing movement to improve the human experience. And that is our vision for the APTA. And that resonates with me. And, in the future, it will probably open up that conversation. What does that mean? How do you transform society as a physical therapist? People need to know what we do. And it starts with movement. We help people move better. We help people in pain move better. We help people just meet some of the goals that they have.
Right. Tracy said she couldn't stay away. so she's joined us. Tracy, thank you for that comment. I mean, I don't know about anybody else, but I'm enjoying this conversation so much because Dr. Mitchell is just spitting out information that is golden. And if students are paying attention, they're writing notes, or they're planning on coming back and watching the replay several times. And they're also going to follow her on Twitter so that they can continue getting all this great information.
And I think also that's important, the coming back to information, because that's where a lot of our knowledge happens. It doesn't happen the first time you hear something. The first time you hear it, it's like, oh, maybe it piques your curiosity. But you have to hear things multiple times sometimes for it to stick. And then your ability to explain it. What was it that you heard?
Right. That's so important. So what would you... So is there a typical day as a physical therapist? What is a day or maybe a week in the life of Dr. Mitchell look like?
Wow. It's different for clinical practice and then for education. And so I would say for education, a typical day is, for me personally, a lot of preparation. I have to go through mental preparations for what is it that I'm bringing forth when I do teach class, making sure all documents are ready, that the students have what they need. And sometimes it's being available to students for what needs that they have based on their schedule and my schedule. Teaching class. So right now classes are virtual and in person. We do have some in-person labs. And so just being prepared for that. Clinical practice is going, when it's fully in person, is going into children's homes. Right now it's a virtual situation where through the camera, I can guide and give input. I can give recommendations for children, their caregivers, their family, into how to help them to move better.
Okay, that's great. See, now I learned something new because I don't think I was thinking that when you're working with a young patient that you're going into the home doing it. I'm immediately thinking of a hospital setting. So
Yeah,
that's
I go. So when I work with children birth to 3, so that's there's federal program for children to be receive their therapy in their natural environment, and so that's daycares. It could be in the home. It could be at whoever's house that the child is at, the daycare
Mhm.
provider, the babysitter, family members, playgrounds, those types of places. Wherever a child is, where they live, where they play. Um, that is where I can provide those services because that's natural to them, that's familiar to them, and that's where you get the best results.
Okay, that's good to know. So say folks that are thinking about physical therapy, or if
All
you
the
know a young person that's thinking
possibilities.
about it, Dr. Mitchell has just opened up a host of possibilities for you.
And
So,
I do want to say there are 2 other organizations for physical therapy. There is the NABPT, which is the National Association of Black Physical Therapists, and they have chapters in different states. And you can check out their website and see if that organization has some resources for you to just kind of learn more about PT and be supported there. And then there's the American Academy of Physical Therapy, which is another organization that supports physical therapists.
okay. This is great. I'm going to get all of these in the show notes and on the banners so that we have these because I think this is important to know. I know, like I said, I'm a big proponent of students knowing about the professional associations and not waiting until they're getting ready to graduate.
Mm-hmm.
I think it's a great place to do research. Just like you
Research.
said, you can go on these sites and you can
Mm-hmm.
find out about different colleges that have the programs and
Scholarships.
scholarships. Yes, 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 yes.
So checking that out ahead of time to know, what the qualifications, just like you want to know what are the
Right,
qualifications for a PT school, what are the qualifications for some of these different scholarships that are available?
right. So I always like to have a book or have a guest recommend a book. So you mentioned a book when we were talking earlier before we went live. So could you tell us what book that you would like to recommend?
Yes. So this book that I would like to recommend is it ties into another passion of mine that I didn't go into too deeply today, but it's learning science. And the book is called Make It Stick. And it really just talks about strategies and techniques for effective studying and learning. And if you have those strong foundations prior to coming into an intense environment of PT school or OT school or speech language pathology school or even medical school, any setting where you're going to have a demand for lots of information, you need to make sure that the way that you study is the most effective, because we don't want to have that illusion of knowledge that holds us back from excelling.
Mhm. I love that. I love that. I love that. I love that because knowing how you learn, knowing how to study is so important. There were so many times when I've had kids in high school and back in the day when I was a social studies teacher, then a high school counselor, students would be in school and they were always at the top of their class and didn't have to study that hard for the grades.
Mm-hmm.
And then they go to college.
It's tough. It gets
And
tougher.
I'll never forget one of my students. She was going to Brandeis University in Massachusetts, and she came back, and students always came and visited at Christmas break. She was so distraught because she had gotten her first C. She had never gotten anything below an A, and oh my God, she was the worst student. She was going to have to drop out, and what was wrong with her? But again, because she never had to like really, really study because it came easy to her in the high school
Mm-hmm.
level. And now you're in a whole different world when you get on a college campus. So I love the idea of this book, and I will put that information in the show notes along with the author and probably a link to the book because
Yeah,
it's something any student, anyone that's in school could
absolutely.
use. And it
At
might
any
even be
level.
a nice gift for somebody.
Hmm. At any level, it's helpful.
Yeah. That is so true. So there was something you said that that triggered this other book. So I wasn't going to do a book tonight, but then you talked about the importance of diversity, but also when we're thinking about Black and brown people, we also have to think about within that diversity, there's a diversity of lived experiences.
Mm-hmm.
Just because my skin color is the same as someone else's skin color doesn't mean we've had the same lived experience. We didn't have maybe the same educational pathway. And there's this wonderful book called The Privileged Poor. And this is by Anthony Abraham Jack. And it's about how elite colleges are failing disadvantaged students. And he really looks at what he calls the privileged poor and the doubly disadvantaged. And you'll have to read the book. I'll put a link in there to the book. I'll actually put a link to one of the summaries. But it goes so much with what Dr. Mitchell was saying about the differences in lived experiences between students, because a lot of times, bias will come into it and everybody will just assume that your experience is the same. And that is so untrue. That is so untrue. And he does a fantastic job in this book of going through that and helping people understand what that may look like for some students on certain college campuses. So Dr. Mitchell, with all that's going on, with everything that you have to do, how do you find your peace? How do you keep your peace for you?
That is a great question. Daily reflections on who I am, who I desire to be, and who I intend to present myself as. A reflection and a focus and an appreciation for life. Because I think being a healthcare provider, I see and I've seen people, at their worst health-wise. And I think, just the appreciation for life. There's not too many things that it's not that serious. I can see the joy and I can find the joy and I can find the message, or I can find the opportunity to continue to move forward in spite of anything that may come my way. So I think just really staying focused on my purpose and knowing how blessed I am, and using this opportunity at all times to be able to support somebody else. I am here because of other people that have paved the way, that have supported me. And I absolutely want to do that for other students, for other physical therapists, for other individuals. Is, let me pave this path for you. And so, I think knowing that anything that I'm doing is bigger than myself, it allows me to take my eyes off of any pity or anything that would kind of keep me down. And it just kind of rejuvenates, and just taking time to find things that make me laugh, to find time to rest and just love on my family, it keeps me going.
Oh, that's fantastic. I love that you said, living in your purpose and understanding that everything that we do is bigger than us. It's bigger than ourselves. It goes beyond right here, what's right here in my four walls or anyone else's four walls. I mean, there might be someone in another country that watches this and it blesses them into spurring them forward to look into a career in physical therapy. And they may say, oh, now that I've done the research, I'm not sure if I want to do that. Or I didn't know all the specialties, the subspecialties that were available to me. And this is fantastic. So again, I love that you said that, because it is so true. It is so, so true. So what last piece of advice or information would you like to give to our audience before we sign off for the evening?
Advice, I think just continue to, assess who you are as an individual, knowing what your strengths are, and always looking and setting goals for yourself and dreaming bigger beyond what, that first goal, like, okay, this is what I want to do, but dream even bigger than that. Because once you take the limits off of just your own imagination, sometimes you will surprise yourself to see what's out there, and then to see what people are available to support you in your dreams. So I know that I am where I am because of, an idea like, maybe I'll teach. And then just being willing and available to different situations that now I have this opportunity to continue to encourage others.
Love it, love it, love it. Dream even bigger. I think sometimes we limit ourselves by thinking, oh, this is it. This is as far as I'm going to go. And I love that you said, by dreaming even bigger, we have all had the opportunity now, because you did dream bigger, to learn about you, to learn more about physical therapy, to learn about the UGMA Institute and the Black Rehabilitation Manifesto, which I'm encouraging everyone to read for multiple reasons. Dr. Mitchell, thank you so much. This was so informative. I love these because I always get to learn. I always get to learn, and I love that this can now be passed on to other folks to learn some information. And for people that want to know a little bit more about the Methodist University physical therapy program, that's the URL there. So you can check that out. As I said, anything that was mentioned, any of the organizations, any of the other URLs, those will all be in the show notes, which should be up in 24 to 48 hours. So you can always come back to the Facebook page and find the event. And it's also going to be on my YouTube channel, which just under Belinda Wilkerson, because I haven't got creative enough yet to change the name, but you could find it there. So again, Dr. Mitchell, thank you so much, because like I said, this was fantastic.
Thank you for this opportunity, and thank you for your vision to bring this forward, that others can benefit from this information, because you have some awesome topics and people. So I'm ready. Like, who else needs to come on here?
I know. So folks, I'm always looking for someone to come and talk. Representation matters. So definitely do that. And we have a thank you from Debelina. She is another faithful viewer. I appreciate her so much. She's usually here every week or watching it on a replay. So I definitely appreciate this, because I do think it's important that we get that information out. So folks that are out there watching, make sure you share this. Sit with people during the replay so that you can have a conversation about it. And don't forget to join us next Monday evening at 7 p.m. for another college and career conversation. So thank you. So, there's one more comment for her. She said she finds these conversations very helpful. Awesome. So thank you for that. That's what we want to do. We're all teachers. We're all teachers. So anytime we can help students move forward in any kind of way, and the students could be any ages, young,
absolutely,
old, returning back to school, So again, thank you so much. And don't forget, guys, go out there and subscribe to my YouTube channel, subscribe to and follow me on Facebook. And again, if you're interested in the monthly newsletter, here is the URL for the newsletter. I would love for you to do that. And this is the URL for the YouTube channel. So again, thank you so much, folks. And I will see you next Monday. And Dr. Mitchell, just stay on for a second.
Thank you.
Bye, everyone.